described as a human tank equipped with power steering and power brakes that would be able to run faster and lift heavy objects, and would also be immune to germ warfare, poison gas, heat, and even radiation from nuclear blasts. It has been used by physical therapists to help people get out of their wheelchairs, use their lower bodies, and fend off muscle deterioration. The Exo, made of aluminum and titanium, actually fits around an injured patient's body and helps restrain the patient to walk again. When a patient is first learning to walk with the suit after an injury, a physical therapist sets the step length and speed and presses a button on a computer to trigger each step. Once a patient has learned to maintain balance in the Exo, he or she can trigger the suit to take a step just by shifting his or her weight. Currently, about 15 rehabilitation centers in the United States are using these suits.
Platelet-rich plasma is blood where the platelet concentration is increased above baseline. This is created by extracting a patient's blood and putting it through a centrifuge. This process allows scientists to successfully increase platelet concentration. This new mixture is then injected into the injured area of the patient. The platelets in your blood contain several growth factors that can stimulate healing and muscle regeneration, as well as limit the scar tissue formation in the recovering area. One of the most common ligaments that are torn is the ACL. There have been many advancements in ACL recovery processes in the last 40 years. In the 1960s and 70s, most ACL tears were misdiagnosed, and athletes and others alike would get severe arthritis. Early methods of surgery involved repairing the ligament torn or using a synthetic material to replace the ligament, but failure rate was very high. Today, the most common corrective procedure for the injury is ACL reconstruction, which involves replacing the entire ligament with a tendon graft. This is a higher success rate, which can be seen in players from the New York Giants at the NFL. 30 years ago, doctors had to reject approximately 80 to 90% of players who had an ACL injury either because it had been missed or reconstructed poorly. Now they pass 90% of players. We have seen many advancements in the recovery of injuries in muscles and ligaments. For you to see the best results, you should use these methods in unison. Don't just go to physical therapy, try using a bandage or platelet-rich plasma, and maybe even get in some time on the Wii. Overall, these scientific advancements have helped athletes and others alike recover from their injuries faster.